January is Cervical Cancer Awareness Month, and we thought that it is important to talk to our healthcare team so that we make informed decisions about our healthcare. Today, we welcome Dr. Nyakabau to help us unpack all the questions that we have on cervical cancer. Welcome, Doc.
Thank you so much, Bella.
Doc, can you introduce yourself to our viewers?
Thank you. My name is Dr. Anna Mary Nyakabau. I'm a clinical oncologist. That means a doctor who specializes in treating cancer. We realize that besides treating cancer, we actually have to make sure that we also advocate that people are aware of the disease so that we reduce the disease burden by the patients or the people doing whatever they can to make sure that they remain healthy, and if they get the disease, to make sure that they come early, either before the disease is invasive or it's gone out of the boundaries, or when it's still at an early stage, because the earlier the disease, the more curable it is. So that's the importance of us coming here to talk about this disease called cervical cancer. Cervical cancer is at the bottom of my heart because it is one disease that I know as people in sub-Saharan Africa, if we focus on, I believe we can reduce a third of the cancers, which means we will only have 2/3 of the cancers to focus on.
Thank you very much, Doc. But maybe I can take you back. What exactly is cervical cancer?
Thank you so much. Cancer is a group of diseases, not just one. You know, diseases that have got the same features, which is an abnormality at the level of the cell. And this uncontrolled abnormal growth can actually form tumor masses, or it can actually penetrate through the tissues and travel to other parts of the body, either to lymph glands or even to common areas like the lungs, the liver, and the bones. When it is cervical cancer, it means the cancer is starting at the mouth of the womb.
Mouth of the womb.
Yes.
So this is a woman's disease.
Yes, it is. Exclusively a woman's disease.
All right. And what are the causes of cervical cancer?
The main cause of cervical cancer that we know now is a virus called human Papilloma Virus. It's a sexually transmitted infection which also can be caused by even skin-to-skin contact. Every woman or man can actually get human papilloma virus, but most women clear it. When it becomes persistent, that's when it can cause problems.
Okay. And how do I know that I have HPV? Shall I call it HPV?
Human papilloma virus.
Yes. How do I know that I have this?
Okay, so HPV or human papilloma virus, not all of them are as dangerous as others. There is human papilloma virus 16 and 18, which are known to cause cervical cancer, and other versions that also are related with cervical cancer causation. And hence, most of our vaccines are based on mainly these two, plus others as well. But you know that HPV can also cause warts, which can be in the area, birth canal area, or the genital area, and then also even warts in some people in the respiratory areas. So people can either show that we've got these clinically, or you can get tested and you are found to have the genetic material that is of human papilloma virus.
All right. So for human papilloma virus, I have to go into a healthcare facility and get tested. Is there any other method that they can know that I have the signs and symptoms of cervical cancer?
Okay, so what we're aiming for is to actually make a diagnosis before someone develops the signs and symptoms.
Okay.
That means the disease is still at a very pre-invasive stage, and almost 100% of such cases can be cured. And this is where people can actually go for what you call cervical cancer screening, where the common one in our environment is called VIA,
Yes, I've heard of
visual inspection using acetic acid.
Yes,
So
I've heard of that. I've heard it. I'm lucky. I'm one of the lucky ones who I get tested every year.
Okay, so the woman goes to the health center, and then they see the healthcare worker, who then makes them comfortable and counsels them about the disease, and then they go on the bed, and then they put something that can be a little bit uncomfortable, but life is about pros and cons. What is it that I'm trying to do? I'm trying to test for this possible disease, which if caught early, it means I am going to be 100% cured.
Yes.
Or to be scared of this metal thing called speculum. Now there are even some plastic ones. Just the discomfort, a little bit of discomfort, and then you have the test done. And then other tests that can also be done are cervical cancer cytology, or there's a common one called pap smear, where they take a sample from the cervix, and then they send it for examination by a specialist doctor called a pathologist.
Okay.
Unfortunately, we don't have enough such pathologists in the country, such that this is the reason why we are focusing more on the VIA, which is effective most of the time, except for the time when women are around their menopause. This is where, in some instances, someone goes for a PAPS or for a VIA, and then later on they are found to have cervical cancer. But these are in the minority. So we are not going to stop doing it to the general population, because we are just going to tell those who are around menopause to, if possible, have another test done like the pap smear. And then there's the one that is being advocated by World Health Organization, which tests the genetic material, the HPV DNA, such that if someone has a negative test, they may not have to have the test done as frequently as someone who is having other tests.
All right. Then now you're talking about HPV. There was a time when I read about the Ministry of Health was rolling out a program for HPV prevention in the young girls.
Yes, there is HPV vaccination that has been rolled out in our country, and I think every year they actually call out for people to bring their children, for public vaccination, and this is to prevent the women from getting HPV, from getting cervical cancer. It's actually to prevent cervical cancer. In fact, every woman can actually, sexually active woman can get HPV infection, but usually women clear it. Probably over 80% of the women will clear it naturally. It's only when the immune system is a little bit low that maybe someone may not be able to clear. And when you get persistence of this HPV that causes cervical cancer, that you are likely to develop precancerous lesions and then cancerous lesions. And this process can take 10 to 20 years. Although if someone is HIV positive, it may take shorter time.
I was about to come to that. So I have my screening and they found out that I have some abnormal on my womb. What's the next step?
Okay, so they then refer such patients to specialist doctors called gynecologists. They can do tests like colposcopy, but with VIA, sometimes even the women who are doing the nurses or the healthcare workers, if it's a simple lesion, they can either hit it or actually, so it's called see and treat.
Yes.
So someone can just get treated there and then. The advantage of that is that, some people who may be coming from far, they don't have to walk back and forth,
Yes.
because the rate of loss to follow up can be high. Imagine if you find a lesion on someone and then you don't treat them, and then you don't even know what happens to them. And when you see them with advanced cervical cancer, how are you going to feel? Heartbroken. Yes. I mean, we do get heartbroken as healthcare workers as well. That's why we really strive to make people understand what we're trying to do for them, so that we can actually either prevent the disease or actually treat it when it's still early.
Talk about treatment. What sort of treatment does one have to go through if they have the cervical cancer at the advanced stage?
Okay, so like I said before, the earlier stage, we stage, when the patient has got the disease, we want to see how far gone it is, and then you then discuss the management of the patient. Different doctors, be it surgeons, be it the doctors who do the test to check that there is cancer, because without knowing that it's cancer, we don't start treatment. We call that a pathology result to confirm the cancer. And then when we have confirmed the cancer, we then discuss the treatment. And fortunately, for example, at our hospitals these days, we have what we call multidisciplinary team meetings, where every patient who has developed cancer is actually discussed at the meeting, and people agree on the best way to manage patient, whether the patient is going to be operated on or they can be referred for radiotherapy. Radiotherapy and chemotherapy together. And for surgery, the earlier stage disease, the more surgically amenable it is.
Yes.
And the earlier the patient gets back to normal.
So when I've heard cases where one said they had to have their womb removed, they would have presented themselves at a later stage, or?
I mean, having the womb removed is actually usually at an earlier stage where they are having the operation for the cancer. For those whose disease is now well established, that is, it has infiltrated the structures, we use X-ray treatment or radiation, because this radiation can penetrate these tissues and destroy the multiplying cells so that they can die, and then we can get rid of the cancers. What gives rise to the side effects is the fact that the radiation is not selective. It hits everything on the way. And for us to be able to maximize the dose that is in the tumor in the surrounding area is how we give the radiation. We give it maybe from different angles or different portals, so that we minimize the dose to the normal structures, because if it is coming from different areas and aiming to where the tumor is, you end up with the high dose on the tumor and less dose on the surrounding structures. And we have to spare the normal tissues. And what actually determines how much we give is what the body can tolerate. And hence the need for someone to have reduced size of tumor, because even if the tumor size is very large, the dose is determined by what the body can tolerate. And even if the patient has got advanced stage disease, we can still do a lot of things to them. We can actually offer them, in addition to the treatments that we may have, sometimes we can use palliative chemotherapy if it is affordable, but we can also even just give palliative care, which is managing the symptoms of the patient, including pain, so that someone can lead a life that has got quality. Sometimes even if the patient has got advanced disease, such that the tumor is such that it has gone through the urinary passage, whereby the patient can leak urine, they can actually have operations that can actually divert the urine so that they can be able to live a normal life, or divert the stool if it has attacked the passage where stool comes through. But this is what we want to try to prevent by raising awareness so that people can come early before we get to the stage. But what I want to say is that there is always something that we can do. Prevention, screening and early detection, treatment and palliative care.
Thank you very much, Doc. So the main thing on cervical cancer is to screen, prevent, and early detection.
Yes, early detection. And I mean also, if you know something, don't keep it to yourself.
Yes.
You share the information.
Yes.
And I think I want to emphasize the fact that whatever we're talking about, many times we forget about ourselves. We are talking to other people. Whatever we're saying, it should start with me.
That's right.
I should be the first one to go for screening.
Yes.
I should actually give a testimony of my screening, of vaccinating my children, not just have a talk show, but actually give testimonies of what we have done for ourselves.
On Sunday, on the 4th of February, it's World Cancer Day.
Yes.
Do you have a message for us, for a solidarity message?
Yeah, thank you very much. I think the theme is about closing the gap.
Yes.
So, I mean, I have got this hashtag where I say access amplifies awareness.
Okay.
Which means we all should see to it that we work towards making people able to access, be it prevention, screening, early detection, treatment, and palliative care. And I can testify that I've done my part. I am part of an organization called Cancerserve, which is involved in actually complementing existing efforts to try and make sure that we improve access to cancer patients towards treatments. And some of our major programs include access to the breast cancer medication called tamoxifen. And as we speak, we've had supplies for 2 years for 280 disadvantaged women per year.
You're doing a great job.
Thank you.
There you go. There you go, viewers. As you can see, the doctor not only talks the talk, but she also walks the talk. So we want to thank you very much, Doc, for sparing time to talk to us. I know we have a very busy schedule.
Thank you so much, and thank you very much, viewers. Anytime.
Yes, and thank you very much, viewers, for joining us today. As you heard from the doctor, early detection saves life, prevention, and make sure that you have our young girls, the 9 to 14, make sure that they get vaccinated against HPV. And
remember, there's always something that can be done for cancer.
Always something that can be done for cancer. And our lifestyle on an individual level.
Yes.
We should also change our lifestyle, go back to our diets that we used to eat in the village, the natural foods, exercises, stick to one partner, and
of course the cigarettes.
And the positive mindset also comes into play.
And maybe ditch the cigarettes.
Yes, you heard that? Thank you very much. We can go on, but we have to excuse our good doctor. Thank you very much, doctor.
Thank you so much.
Like I always say, your health is your wealth. Until next time, thank you.